Hello and welcome to the Zermed Show. I'm your host, Dr. Braha. On the show, we will feature local physicians and healthcare leaders who are experts in their respective fields and who will share their experiences and wisdom with us. We cover a broad range of health topics on the show, and today we have Dr. Kabarriti, Chief of Urology and Director of Robotic Surgery at New York City Health and Hospital South Brooklyn Health. So Dr. Kabarriti, welcome to the show. It's really an honor to have you here.
Thank you.
The role of the urologist is very important, as we're going to get to very shortly. But before we talk about South Brooklyn Health and your urology department, let's learn a little bit about you. Tell us about yourself.
Sure. I was raised in Brooklyn, actually not too far from this hospital, from this neighborhood. I completed my medical school training at the top-ranked Mount Sinai School of Medicine, after which I went to completed the prestigious residency at the University of Pennsylvania, where I worked with a lot of pioneers in the field. In addition, as part of that, I had a chance to do rotations at the Children's Hospital of Philadelphia, which is one of the top-ranked pediatric urology programs in the world. After completing that, I knew I wanted to come back to Brooklyn to give back to the community where I grew up and to bring a lot of what I learned back to this community, and that's what brought me here.
So here at South Brooklyn Health, you are the chief of urology. Urology is a large field. It's not specific to one or two things, as many people think, kidney stones and the prostate, but is a very large area of medicine, and we're going to delve into that now. Tell us a bit about urology. What does that word mean? What should the viewers today know about urology, and what areas of the body does that cover?
Yeah, unfortunately, there's a lot of misconceptions about urology, as you know. A lot of people think it only affects older men, and that's not necessarily true, because as I mentioned earlier, there's pediatric urology, which involves children, but patients of all ages can actually be affected and may need to see a urologist. There are conditions that happen at any age, such as kidney stones, for example. Patients can get them at any point in their life. Now, there are some issues in urology that are very sensitive, and I think that keeps a lot of people away from seeking out a urologist's opinion. So, for example, incontinence, erectile dysfunction, a lot of people don't necessarily want to talk about that. They either feel ashamed, they feel that this is a normal part of aging, they feel that this is normal to happen, but it's not always the case, and patients can benefit a lot from speaking and seeking out a urologist.
Yeah, so for the viewers watching today, the urologist is more than just a stone, and it's more than just a urinary tract infection. There are many, many things that could affect us. Going to the bathroom too frequently, too little, waking up in the middle of the night.
Right.
For the men watching, what is the most common thing that you see in your practice that men are ashamed to talk about, maybe in the urologist's office?
So erectile dysfunction is definitely up there, because obviously no man wants to talk about it and mention it, but it is very important that we talk about it. It's very important that they seek the urologist, not necessarily because they need treatments or they need surgeries for that, because there's a lot of other things that we could do. But it's important just to take that first step and admit it and seek that help that they need.
And this could affect any age.
Correct. Well, we have a lot of men of all different ages. Men in their 20s, 30s, 40s. It is more common in older men, but it can happen at any age.
So it shouldn't be an embarrassment for any of the men watching today. It's a common problem.
Correct.
Important to see the urologist?
Absolutely. And, that's one of the things that I want to stress is the importance of seeing that. Now, I know we're talking a little bit about erectile dysfunction. And just to point out why it's important, right? Erectile dysfunction could often be the first symptom that presents and can actually precedes a heart event by a few years. And for younger patients who have erectile dysfunction, they are at a significantly higher, they almost have a 50 times higher risk of developing heart problems down the line. So by seeking that care initially, you could prevent a lot of significant health cares and risks down the line.
Yeah, so there are parts of our body which may signal signs of disease from another part, and so if someone watching today with erectile dysfunction, it's not just about the symptoms of erectile dysfunction, but some underlying issues that might be going on with the man watching, such as heart disease, and you can help prevent that by detecting these problems.
Absolutely. And there's urology also extends beyond symptoms. So, for example, prostate cancer screening, right? So patients can be completely asymptomatic and not have any issues, any symptoms. They're living their life completely fine, but they could still have, prostate cancer, and they may not know it. So it's important to seek a urologist for that reason, because through that testing, through the screening test that we do, that's how we catch it, and we catch it early where we could potentially treat it.
Yeah, many men have a question of when should they start screening for prostate cancer? Who should they see to start screening for prostate cancer? And then maybe tell us some of the signs. I know that many times it can present silently, as you said, but what are some of the signs of prostate cancer?
The most unfortunate thing is the fact that most prostate cancers, until they are advanced, actually do not have any symptoms, and so you cannot wait for the symptoms to happen in order to seek care. Now, in terms of the age as to when do you start screening, that really depends on a couple of things. There are a couple of major risk factors for prostate cancer. So, for example, we may start a little bit earlier in a patient who has a very strong family history. So, whether they have their father who had prostate cancer, a brother who had prostate cancer, for that patient, you may start the screening process a little bit earlier. Similarly, in terms of the frequency of and how often you do it, that I think depends on the risk factors. Age is definitely a risk factor for prostate cancer, as is race. African Americans are at a higher risk for developing prostate cancer. So there are many risk factors, and we try to tailor the screening to the risk factors for that patient.
Let's shift a little bit, because we're talking a lot of men's problems here. Let's focus on issues that might affect both people. An embarrassing problem that we see in urology that people are sometimes ashamed to talk about, and I see it a lot in our practice in gastro, is men and women, but sometimes I hear it more from women, about incontinence. That sometimes they're leaking urine, or they can't hold it in, or they're waking up a million times in the middle of the night, they go to the bathroom and they get one drop. Tell us about women with incontinence issues and overactive bladder, and also with men. Maybe you could enlighten the audience on that.
Absolutely. Overactive bladder is a common problem, as you mentioned, and actually it can be linked to issues that they're having from a gastroenterology standpoint. And a lot of times patients that come in for overactive bladder, we find out, for example, that they have also issues with gastroenterology. And I think one of the things that I want to stress is the importance of working in a multidisciplinary team, right? So you have a patient who comes in with incontinence and urine problems, but you discover other issues that are going on. For example, they may not notice, some symptoms that they have, or they may not have linked the two. We could catch that in urology. Now, you're correct in that incontinence affects both men and women, and that's one of the myths that I wanted to kind of put away, is that urology is not just for men; it is for women. And like you said, a lot of people don't necessarily come to seek care because it's an embarrassing topic. I mean, nobody wants to talk about urine coming out before they reach the bathroom, which is what overactive bladder is. So patients getting the urgency to go to the bathroom and not being able to make it to the bathroom in time, that could be very embarrassing. Many patients may even require to use pads or diapers for that, and it's understandable why patients would be embarrassed to come and talk about it. So what's very important is in urology, one of the things in terms of when building the division is making it so that the patients are comfortable talking about it. And I think that is the most important thing in terms of how do you deal with patients, how do you get them to talk about it. Obviously, the patient has to take that first step of coming in, but on our part, what we do is give them a scenery, a place where they could be comfortable discussing a lot of these things.
Yeah, these are tough topics to talk about. The prostate, erectile dysfunction, running to the bathroom, not making it to the bathroom. We see this a lot in gastro, and we try to open up the conversation. So creating this type of environment is important. And for the viewers today, if there's any thought that they might have a urologic issue, if they want to get in touch with you, if they want to come down to the clinic, is it easy for them to make an appointment? Do they need a referral? How should they come and come and see you or your colleagues at the urology office?
Yeah, so that's one of my biggest projects is making it accessible, right? So a patient that needs to be seen will be seen as quickly as possible because nobody wants, to hear that, okay, fine, great, you have a problem, but I'll see you in a few weeks, a few months. And that was one of the major things that I really wanted to work on. And what I really tried to do in building the division here is bring that Ivy League mentality that was at the University of Pennsylvania and bring that here locally to our patients in Brooklyn.
Yeah, so the office here or the urology department here, you offer the services across the gamut of urology.
Absolutely.
Tell us about some of the fun toys and the equipment that you're using in the operating room to take care of patients with urologic disorders.
Right. So, in terms of we deal a wide breadth of urology, right? So we spoke about a little bit, briefly about, children, pediatric urology, which is predominantly focused on children. There's also, voiding dysfunction, which is predominantly the urination. There's a whole subspecialty of urology which just deals with cancer. There's a whole subspecialty which just deals with stones, infertility, erectile dysfunction. So there are a lot of different subspecialties, and one of the things in setting out the division is really provide a division that could provide this comprehensive care, but provide it at the highest quality, and that's what we set out to do. It usually doesn't start out necessarily with surgery. So the most important thing for me is when I meet a patient is figure out what they want, because it's not about what I want for them, it's about what they want for themselves. So you bring them in and we deal with patients from a lot of different cultures and a lot of different beliefs. And what could work for one patient may not necessarily be appropriate for another patient. So the first time we meet is really trying to figure out where do you want to be, and how could we help you. So for a lot of patients, we could do that even without any medications or surgeries. And if that is the appropriate treatment, then that's what we will do. Then typically we will move on a little bit, to medications, obviously going from the least invasive to more invasive. If need be, then we could go down, the route of surgery, and depending on what the underlying issue is, there are different types of surgeries that we offer. We try to minimize the surgeries in terms of providing them really with the latest technology. Urology has come so far compared to where we were even just 10 years ago, let alone 20, 30 years ago. And my goal is to provide our patients really with that highest quality and the newest technology.
Yeah, patients always ask, if I have a stone, how are they going to get it out? If I have a problem on my kidney, how will they operate? Explain to the viewers some of these types of procedures that you're doing, say for kidney stones, or if someone has something wrong inside of the bladder or a tumor, God forbid. How do you treat these mechanically or surgically with procedures?
So thankfully we've come a long way, and we no longer have to make these big incisions to take care of that, to take care of those things. So for example, for kidney stones, usually we go in with a small camera through natural openings. So we don't make any incisions. We just go in through the camera, try to go up, find the stone, use a laser to break it up, and then take the small pieces out. Similarly, same thing for bladder tumors. Typically, we use a camera to go in and just kind of remove that. To be frank, for the patient, when they wake up, they don't see anything, and a lot of them, are surprised, like, how did you do that?
There's no scar.
And there's no scar, and that obviously helps in the recovery, because the recovery ends up being so much faster. Because you're not making any incisions, the healing process ends up being much faster as well.
So much of what we do today, and in your field of urology, is minimally invasive.
Correct. No
scars sometimes, or even if there is a scar, little tiny cuts. So that's all available here at South Brooklyn Health with your urology department. Talk to us a little bit about, you said this, bringing the Ivy League to South Brooklyn, the family approach in Brooklyn. How did your growing up here and your education affect this, and how are you implementing some of these traits and characteristics that you described here at South Brooklyn Health?
So that's a great question. One of the biggest reasons I came back is because I want to give back to the community and wanted our patients to get really the top quality care. I'm quite involved actually in teaching residents, and a lot of times when there's any issue, I have a line, a motto, I guess, if you want to call it. Treat patients like family. You'll never go wrong, because you're never going to make a wrong decision if you treat every person that comes in like they're your family members. So it's really about providing that type of care that myself, my team really strives to provide. And I really think that makes a huge difference in terms of the outcomes. Because, as you know, as physicians, we're always faced with, medical dilemmas. Do I do this? Do I do that? But by treating the patient as one of, your family members, I think it makes it much easier to treat them properly.
So you're building this urology department here.
Yeah.
What are some of the goals for the future? What do you foresee as new advancements here at South Brooklyn Health? What are you looking to build more of? And what's the bright future here look like?
So we are rapidly expanding as a division, and I think there's a lot of excitement being generated. As you know, we have a brand new hospital that is slated to open in early 2023, and with that, it will allow us to really provide state-of-the-art care to all of our patients. That includes both from the operating room all the way down through their discharge. So I'm excited for the patient population around South Brooklyn Health, because once the new hospital opens, I think they will get care that is comparable with anywhere else in New York City, let alone potentially even in the world.
Right, and you trained at some of the top institutions in this city and in this country. What does it feel like to be able to now do this here? Is it, to bring to your own community what you learned over at Mount Sinai and what you learned at University of Pennsylvania? How good of an accomplishment does this feel like for you and your family, probably?
For me, I mean, the biggest, the thing that provides me the most satisfaction is seeing my patients do well. And nothing really brings me more satisfaction or more happiness. It's not about, what I want to do. It's seeing a patient walk out very soon after surgery, having minimal scars, having minimal pain. That to me is what provides me the biggest satisfaction.
Yeah, and some of these advancements that you're bringing from these Ivy League institutions here to South Brooklyn haven't been here before. One of them that we were touching on before is the minimally invasive procedures that you do. There's a robot out there that patients hear a lot about.
Right.
They hear about it from different surgeons. They hear it from their friends that they had robotic surgery. And you came from two institutions which are well known for advancing robotics.
Right.
Give us a little insight as to maybe what the future here in robotics is and what you might have learned at Mount Sinai or what you learned over at UPenn and you're bringing here.
Right. So the robotic surgery, we usually reserve that for patients who need surgery. So historically, for example, for patients who had a kidney cancer or even prostate cancer, to do that surgery, we had to make these big incisions. The blood loss often would be very high. With the advancements of the robotic surgery, now we could do these surgeries and the patients can leave in some cases the same day or even the next day. There are a lot of advantages both to the patient and to the surgeon. To the surgeon, the robot gives you 10 times the magnification. So imagine like you're doing it under the microscope. In addition, it allows you to provide a very precise surgery. So everything can be done extremely precisely, almost to millimeters we're talking about here. And as you know, millimeters make a huge difference when it comes to surgery. For patients, the recovery tends to be very quick. As I said, a lot of them could go home the same day or the next day. The blood loss, we're talking about radical prostatectomies when the prostate needs to come out for prostate cancer. Historically, patients used to have to donate their own blood because of the high risk of losing the blood during surgery, and that blood will be given back to them. Now, it's rare that we actually give blood, for a prostatectomy. And the recovery tends to be, again, very quick. Most patients are, out of bed and walking around and almost feel, wow, did I really have that big surgery? And I'm ready to go. So I think there are a lot of advantages. And that's what I tried to bring here. Both, as a director of robotic surgery, I obviously wanted to bring that to urology, but we've expanded it actually even to services beyond, whether that's general surgery, whether that's colorectal surgery, whether that's, thoracic surgery. And that's our goal, is to, and GYN, gynecology as well. So it's working in that collaboration all together to provide our patients the top quality care.
And these services or this robotic surgery is here already? Is it in the future? Is it coming here?
Oh no, it's here already. We're actually currently doing it, but we are very excited about the move to the new building as well. Where I think we stand to gain a lot.
So the latest and greatest in urology and in surgery is available here at South Brooklyn Health.
Correct.
It's impressive. Now, as part of your routine, as part of your day here at South Brooklyn Health, how much time do you spend in the office? How much time do you spend in the operating room? How much time do you spend teaching other doctors?
So we are very involved in teaching other, rising doctors, younger doctors as they come through. So I'm a big believer in training the next generation because I think that's how you can make a big difference as well. So while practicing here allows me to give back to the local community, training future physicians allows me to give back to the broader community well beyond South Brooklyn and well beyond New York, to be, quite frankly. So I do spend, I obviously spend all the time I need to with my patients in the office, and I'm usually operating, a few days a week.
Very exciting. What are some of your hopes for the future of urology? We talk about prostate cancer, we talk about kidney cancers, you're removing these robotically, sometimes you're treating these without surgery. What is the future of urology itself? What are some of the late-breaking research projects that you're hearing of, or cures and treatments that our audience might be interested in hearing about?
Yeah, I mean, depending on what it is we're talking about, right? For prostate cancer, I think that the treatment, the paradigm has been shifting. We are moving a lot more towards what we call active surveillance. So a lot of these cancers don't necessarily need to be treated, and a lot of these can be just watched to make sure that they don't advance. So I think from that sense, I think that treatment paradigm has shifted. But again, it really depends on the nuances of the cancer, and that's what where the urologist comes in, making sure that you talk about all your options. Because as I mentioned, not everything needs surgery, not everything needs medications. I think there's a lot of excitement in urology as we go more towards more minimally invasive. As small as these incisions are, they keep getting figuring out ways to make them even smaller and smaller, and even less invasive. So more procedures that even could potentially be done without anesthesia. So there's a lot of excitement. I think the field has moved a lot in the last 10-15 years, and I'm very excited to see where it goes in the next 10-15 years.
Right. So we're talking with Dr. Kabarriti about urology. He is the head of surgery when it comes to urology here at Robotic Surgery, building an advanced urology department here. He's teaching, he's taking care of patients. It's just very exciting news here at South Brooklyn Health. What would be some of your takeaway messages today? We talked about prostate cancer, we talked about kidney stones, we talked about overactive bladder, erectile dysfunction. What are some good takeaway points today as we come closer to wrapping up our show today? Your key points of advice for our viewers, men and women, today.
So I think the most important thing, and unfortunately we saw this a little bit with COVID, a lot of patients stopped going to get their preventative care, their screening that they need to. And my biggest takeaway is this could save a lot of issues down the line. Make sure you see your primary care doctor. Make sure you see any doctor, the doctor that you need for the screening. Second is don't be ashamed. And we're all professional and we're here to help you. And that's we're only here to provide the care that you really want and that fits with what you want for yourself. And every patient is different. And I think it's important to seek care where they work, in a multidisciplinary team. So again, going back to that erectile dysfunction, I can't tell you how many times I have patients come in and I find out that their blood pressure is very high or their sugars is completely uncontrolled. Even though I'm able to treat that erectile dysfunction, the satisfaction is being able to treat those other conditions. And it's important to be able, to get that under control because that's really what prolongs, a patient's life.
So Dr. Kabarriti here is a urologist. He is involved in the care of many aspects of the daily sort of activities that we go through, going to the bathroom, taking care of our prostate, taking care of our kidneys. And so if you're watching today, this is the most advanced type of care you can get here at South Brooklyn Health when it comes to urology, whether it comes from urology, surgery, to screenings, and to medical treatments. And so it is very important for the viewers today to understand how you are providing this care and not to be ashamed to come in the door and talk about problems that might be embarrassing,
Right.
that we don't talk about with our friends or our family usually, but Dr. Kabarriti is able to have this sort of embarrassing conversation, which is really you and I deal with on a daily basis. So I want to
hopefully when they're talking to us, it's not
it
embarrassing.
should not be uncomfortable. So I really want to thank you for joining us here today. It's an honor to meet with you, and I think South Brooklyn Health is honored to have you because you seem to be top in your field, well trained, and really nice to meet you. I think your patients would really enjoy being with you and talking about some of these uncomfortable topics.
Thank you very much.
Thank you. And thank you for your interest in the show and desire to become involved and educated in your health. I invite you to visit our website at www.zermed.com. Check out our tools, connect with us on social media. You can also call us at 718-510-2103. So if you're watching today, thank you and take care of your urologic health. Stay well and be safe.